Okay, so this is the video for therapeutic ultrasound, and my patient here, Bonnie, is a 26-year-old mother. She's had chronic low back pain for the past 2 years. It's on the right side of her spine near the L5 vertebra, tender with palpation, no radiating pain. And so she's in the remodeling phase of injury healing because this is chronic, it's been going on for a while. In terms of relevant indications, typically ultrasound is used for tissue dysfunction, soft tissue dysfunction, for helping with strains, sprains, and contusions that are associated with pain, sometimes muscular spasm. Contraindications that could be relevant with this patient are any impaired pain or temperature sensation, any impaired circulation. You want to avoid doing ultrasound over the spinal cord, and if there's any malignancies in the area, you'd want to avoid this if they have a history of clots or deep vein thrombosis, if they have any cemented joints in the area, or if the individual is pregnant. Okay, so I'm going to go ahead and just hop right in here. Hey Bonnie, how are you doing?
Doing good.
Good. So what we're going to do today is ultrasound, and the purpose of this is to essentially try and help with circulation to the area and to promote healing factors, the cell's own ability to heal, by sending high-frequency shock waves into the area, and it just sort of helps the cells in the area to release certain factors that should help with the healing process.
Okay.
So I will need to have access to your lower back area. Is that okay if we go ahead and do treatment? I'll need you to lift up your shirt in that area.
Yeah,
Yeah?
that's fine.
Okay, excellent. So what I'm going to have you do is just lay face down on the table here. Okay, and actually just before we get started, I want to ask you a few questions here. Do you have any altered sensation or circulation in that area?
No.
No? Okay. And do you have any history of cancer or blood clots?
Nope.
Okay. Do you have any cemented joints in that area? Did you ever have low back surgery for fusion?
No.
No.
Nope.
Okay. And are you currently pregnant?
No.
Okay, good. So let me just know if you experience any sort of discomfort over the course of treatment, okay? Don't try to bear it, just let me know. More isn't necessarily better with this type of thing.
Okay.
All right? Okay, so for the time, we're gonna increase this to 10 minutes. For the intensity, I'm gonna bring this up to 1.5. And then we're going to increase this, or rather leave it at 1 megahertz so that it penetrates a bit deeper, and leave the duty cycle on continuous in order to have a thermal effect here. So Connor, I'm going to go ahead and lift up your shirt just a little bit to expose your L5. I'll fold this down a little. Before starting the machine, we want to make sure that we have some conductive ultrasound lotion on here in order to protect the crystal. Okay, so we just started the machine, and I'm going to move the head of the ultrasound in a circle, nice and slow, maintaining full contact with the skin, with an area of about 2 to 3 times the side of the effective radiating space, which is the side of the head. Okay. Do you feel anything, Bonnie?
Yeah, it's a little warm.
A little warm? Okay. Or just let me know if anything changes. You shouldn't feel any amount of discomfort, all right?
Okay.
Okay. So for the purposes of this video, we're just going to leave it on for about 30 seconds. I'll clean off the head here. Make sure to clean up my patient. Okay. Check the area. The skin looks good. And that is how you do therapeutic ultrasound.